I'm going to try to tell you this story as calmly as possible because my blood is boiling right now. But this is what happened to me recently. So I sent for a prescription for an asthma inhaler called Symbicort. It's used commonly for persistent asthma symptoms, but also sometimes used as needed in specific situations. And CVS came back and sent me a request for a prior authorization, or I could choose from this alternative formulary list. So I decided after looking at this list that I would send for Dulera at an equivalent dosing to try to bypass the prior authorization process, because that takes quite a bit of time and effort in order to get the medication covered, and sometimes it doesn't even get covered in certain situations. So I send for Dulera, and then almost immediately I come back with another list saying that Dulera also needs a prior authorization. So my nurse helps me out, calls to get that prior authorization done, and during the process somebody tells my nurse, well, can't the patient pay it out of pocket? I'm really thankful for my nurse for advocating for my patients, because she was very firm on making sure that we could get something covered, and we ended up getting that Symbicort covered. But this is the types of hoops that healthcare workers often have to do in order to provide good healthcare for their patients. So I'm thankful for your patience whenever you have to deal with this type of issue. I'm thankful for my staff, and I hope you have a happy Thanksgiving.